Okay, so for our lumbar spine palpation anteriorly, we're just going to check first of all for the symphysis pubis. So for this, we would come with a karate chop hand and go for the hypothenar eminence and basically palpate downwards towards the symphysis pubis. Obviously with female patients, you do this really to ensure comfort of the patient and also dignity, and making sure that you talk to the patient before you do this about what you're going to do and the reason why you're doing it. And then we also go across and palpate the ASIS, which is basically the anterior superior iliac spine, which is a bony point that you can feel at the front. And then we were going to palpate between the symphysis pubis and the ASIS, which is your inguinal area, between which you're going to check for hernias or for the lymph nodes being swollen in infection type conditions. Then you can come up and across, and actually from the ASIS follow the iliac crests, so the iliac crests across, and looking for things like hip pointers or apophysitis. So just generally checking through the iliac crest and also the soft tissues surrounding that. And then from there we're going to come onto the front or into a prone position, and we're going to look at the lumbar spine palpation in prone. So posteriorly in the lumbar spine, we're going to orientate ourselves first of all by coming to the iliac crest, and then if we come across to the spine, the lumbar spine, we'll be at the level of L4-5 vertebra. Then what we can do is palpate that vertebra, and we can go down to L5-S1. In a lot of patients, or some patients, if they've got instability or spondylolisthesis, you'll feel a dip in this area, or what's called a step-off sign, so just be on the lookout for this. And then we can palpate upwards from the L4-5 spinous process and just check the spinous process is up from L5 to L1. 2 to 3 centimeters laterally to the lumbar spine, so if we come back to L4-5 again and go 2 to 3 centimeters lateral, we will find the facet joints and the muscles overlying these. So again, similarly to the spinous processes, we can go to the facets and then move superiorly from L4-5 to L3-4, L3-2 and L2-1. Then if we come back down again and orientate ourselves onto L4-5, and then we go onto L5-S1, and then we go centrally, we can go onto the sacrum, so we can palpate the sacrum. And if we move distal centrally on the sacrum, we can come onto the sacral hiatus, which is essentially where the sacrum drops off. We come back up to the sacrum again, and if we go from across onto the PSIS, so if we come across onto the PSIS, so posterior superior iliac spine, and then we come across to the sacrum, that would be level with S2. So S2 is level with that PSIS. Then if we come across again onto the iliac crests, we can come posteriorly, or inferiorly rather, onto the greater trochanter. So if we come down, we can reach that greater trochanter, which is a bony point on the lateral aspect of the hip. And then if we go to the PSIS on the same side, we can then palpate between the 2 points to palpate glutes, but also the sciatic nerve is found midway between the ischial tuberosity and the greater trochanter. So we can also from here, if we go to our ischial tuberosity, which is the bony point on the inferior aspect of the gluteal line. So if we come to that, so between ischial tuberosity and the greater trochanter is the sciatic nerve. So midway between those 2 points.